So to get going with our region, the first person I'd like to introduce is LaMeshia Whittington from the North Carolina Black Alliance. LaMeshia Whittington is a professor in the Division of Sociology at Meredith College in Raleigh. She's also the Deputy Director for Advanced Carolina and the Campaigns Director for the North Carolina Black Alliance. She is the co-vener of the North Carolina Black and Brown Policy Network, former National Democracy Campaigner for Friends of the Earth, chairwoman of the Frank Fund Administration, founding member of the Democracy Green, member of the Burke Women's Fund in Western North Carolina, and the former North Carolina spokesperson on Fair Courts for the Leadership Conference on Civil and Human Rights. Professor Whittington leads the work on intersectional democracy and environmental justice. She was co-author of the North Carolina Senate Bill 673, prioritizing environmentally contaminated communities of color and voting rights, and a co-author in several pro-democracy North Star legislation bills. Professor Whittington is a member of the North Carolina PFAS team anchoring AFFF legislation and a convener of the Black Firefighters Fighting PFAS Collective. Professor Whittington has created and co-convened national, regional, and statewide tours and workshops on environmental justice, namely chemical contaminants and dirty corporations. Professor Whittington continually works with the Brody School of Medicine at East Carolina University, the Department of Health and Human Services in North Carolina, and government agencies to ground community needs and strategies in alleviating health disparities in Black and Brown communities. Professor Whittington led the development of a statewide map to highlight the intersection of environmental justice contamination zone and the frequency in which they are located within gerrymandered Black majority voting districts. Professor Whittington is a petitioner in 2 active petitions to the U.S. Environmental Protection Agency. For more information, PFAS and 1,4-dioxane. Professor Whittington is an Afro-Indigenous woman from North Carolina, hailing from a former environmental justice settlement, the Kingdom of the Happy Land. She received her education at Western Piedmont Community College and Meredith College, where she is now on the faculty. LaMeshia.
Thank you, Dr. Birnbaum. Always an honor and pleasure to join alongside you. It is a pleasure to be here this afternoon. As Dr. Birnbaum already mentioned, I'm a lifelong North Carolinian and advocate in the state of North Carolina. And so today, our discussion, this town hall has been incredible, a wealth of knowledge and just a deep appreciation to the advocates, the community experts, the scientists and so forth that have lent their voice in unison to call to task the needed testing that we need for our communities broadly across the nation. So my presentation today is a hyper focus on our community crisis. And so Black and Brown communities, unfortunately, we face many layers of impact that many know as cumulative impact. So we unfortunately can't afford to solely look at water, right, and drinking water. We also have to look at exposure to food sources and food packaging. We also have to look at medical deserts and medical maternity deserts that limits our ability to access equitable healthcare and affordable healthcare. We have to look at the exposure to a multitude of environmental contaminated industries. And what does that mean, especially in the midst of a pandemic? So my outline for today, and my goal is for folks that are listening in to ensure that I'm reading from my slide deck, which is the purpose for auditory visual learners, as well as our communities living with disabilities. So the outline for today is just the introduction, how Black and Brown populations are impacted and where we see our potential health effects, right? What are the populations and what are key priority target areas for our communities? And what is the value in testing our community members? And of course, medical support needs that will hopefully begin to speak to the restitution and support that our communities can access with clinical studies and guidelines in medical deserts, in food deserts, in areas, again, that are in deficits of infrastructures that can support our communities. Again, Dr. Birnbaum already introduced me, so I'll skip through here, but giving honor to where I'm from. I'm from the Blue Ridge of North Carolina, which is my background. And this is part of the former land, the settlement, the Kingdom of the Happy Land. And so my folks have been here prior to the establishment of the United States. But why this means so much to me is it's my state, it's my home, it's my land. But it also, I've seen climate change and I've heard the stories passed down for generations, the impact that we're now seeing with corporations, what's changed over the years, right? Again, I'm with North Carolina Black Alliance in Advanced Carolina. We specialize in building Black political and economic power, both in a C3 framework and in a C4, actually speaking truth to power with legislation and working in tandem with Black elected officials to anchor the policies we need to clean up these contaminations. So the introduction for myself as it pertains to PFAS, right, came about 2017 when many North Carolinians saw the expose, the elevation that for decades, PFAS and chemical contaminants had been dumped into the Cape Fear River. History, if we could speak briefly about timeline, in 1980, we saw DuPont, formerly DuPont, now Chemours, journeyed into their, industry of working with these chemicals, right? And various chemicals that have gone into production and such as we know has been released. Around the same time in North Carolina, for folks who are from this state or at least familiar about hurricanes and have tracked them, 1980 was the introduction for DuPont in our state. In 1984, we experienced Hurricane Diana and Hurricane Fran in the Cape Fear River area. So simultaneously, we're having breaches in our water systems, breaches of dams, and it's infiltrating our communities and our lands. That has persisted. That's been a trend, right? So even though our communities became aware of the decades, the legacy of PFAS being dumped into our waterways, right? We were also dealing with climate disasters, major 500, 1,000 year floods. The Cape Fear River watershed is the largest watershed in North Carolina. It provides drinking water to 1.5 million North Carolinians, and close to 1 million of our folks unfortunately receive in that water contaminants that come from industrial contamination. So out of 1.5 million served by this watershed, 1 million, right? The impact of having industrial contaminants. So you're seeing kind of what we're dealing with in terms of the numerous residents, counties, our lands. So Hurricane Florence, the impact for us was close to 500,000 people were evacuated. Up to 11 dams were breached or failed. Over 75,000 structures were flooded. That includes family farms and that land also being contaminated. What we saw and what we're aware of as environmental advocates and folks on the ground is that not only was this water breaching into our homes and our front doors, but it was also contaminated with coal ash, animal waste, sewage, and human byproduct. But what wasn't elevated was PFAS, right? So the year prior in 2017, when it was elevated that PFAS had been found into this investigation to be dumped over the decades, right? The next year in 2018 comes Hurricane Florence. PFAS should have been included as a part of that contaminant list that was in these breached dams and failed structures downstream of the Cape Fear River, but it wasn't. So we see that the poisoning of the water of 350,000 plus downstream residents was happening again for decades. So again, I say for Black and Brown communities, where are our primary concerns? We've heard a list of many concerns today through this town hall, and it overlaps. Our concerns are the same. But the elevation I really want to make clear is that we are dealing with cumulative impact in our communities. Black and Brown communities are not synonymous with low wealth. I want to be very clear that there are low wealth populations that are Black and Brown, but it shouldn't be used as all Black and Brown communities are low wealth. So you'll hear me make that distinction. One such area of concern for us is housing. For us, when we are fighting for affordable housing, communities who are in subsidized homes, we understand that, whether you're in affordable homes, housing, or you're a renter, that there are infrastructures within that house that the landlord or the apartment corporation won't require you to remove, such as the carpet. So what we found, over 35% of all North Carolinians are renters. So for our folks out of that 35%, specifically in Eastern North Carolina, this is broadly the state landscape. But when we're looking at affordable housing, we've seen carpet being used that has stain repellent that includes Guess what? PFAS. Again, it's a class. There's various chemicals, and this is the largest source of exposure to our children is through this carpet. Yet we don't have the option to remove that if we find that it is contaminated. Another area for our communities. In North Carolina, I'm a rural woman. I was raised, as I said before, in a rural community. It's very close and near and dear to me. The representation of the triangle does not represent fully the landscape of all of North Carolina. Why do I say that? 80 out of 100 counties in North Carolina are considered food deserts or areas with food deserts. This is incredibly important for the next point of exposure of PFAS for our communities. So for food deserts, in this map here, elevates the concentration of populations that are without a vehicle and are at least 10 miles away from a grocery store in rural areas, or 1 mile away in urban areas and no vehicle. The deeper shade of the green, the more population that is without cars, okay? And miles or a mile away from accessing fresh fruits, veggies, sustainable foods, right? Options. This is the same area, Sand Hills, southeast, that is downstream of the Cape Fear River. This is the same area in which Hurricane Florence breached and many other hurricanes since and prior. Okay, cumulative impact. Our folks are facing food deserts, accessing fresh foods, also being in a climate disaster prone area. The cumulative impact, again, the layer of exposure is adding up. So when we're talking about our folks in food deserts, what is the primary source of an employer or a meal for your family? Usually that's fast food for our communities. Our fast food industries, unfortunately, has been found to have concentrated PFAS in the food packaging. And you know, I like using the statistic in community with community members at different organizational meetings, just to hammer in the fact that a study was found that 56% of dessert and bread wrappers were found to contain PFAS. We see the same with burger and sandwich wrappers at 38%, and paperboard that contains your fries at 20%. So your main containers that are holding your food, or that is sitting in the back storage, holding the food before it goes into, service to the customer, guess what? It is sitting in PFAS contaminated packaging. So for our essential franchise workers, for our communities that are located in these food deserts, their primary source of food is what? Food deserts. So we have to look at the contaminant and understand and track what are the available opportunities to test, to also, is there an opportunity for OSHA studies for fast food workers? Just thinking through supporting these 481,900 North Carolinians who are food service employees or workers. Another source of contamination for us in points of concern, in addition to franchise workers, is also essential corporation workers and farm workers, right? So when we're talking about farm workers, let's discuss land in proximity to these corporations. From the Smithfield subsidiary that's here, that's actually in close proximity to the DuPont Fayetteville Works plant. What is the air emissions? Right. So when we're looking at runoff into the groundwater, when we're looking at the actual air emissions on our crops, our plants, our livestock, a presenter prior to our panel discussed the fish. These are all concerns. But what about the workers and the farmers that are constantly laboring in this contaminated zone in their fields, in their land, on their land? What does that mean for that long-term impact on health? The same with essential workers and corporation workers. What happens when we have essential workers and the testing that needs to be done to say, okay, this poultry plant or this pork plant is in proximity. The water that the pork is sitting in is contaminated with PFAS. The packaging is contaminated with PFAS, and then it's shipped, not just statewide, but globally. Doesn't just stop and start at home. But also, what about those essential workers that are unfortunately in those work conditions? Are we tracking that long-term impact on health as it relates to closer proximity over long-term for these essential and corporation workers? And what does it mean to be exposed to both, right? The contaminants that come with a corporation such as a pork subsidiary combined with the impact of PFAS in the bloodstream and air emissions, right? And let's also note that in rural communities and some urban, sometimes the most inexpensive meal, aside from fast food, can be the food from the plant that our workers are laboring at every single day. So now, again, there's a triple impact on our folks. So our concerns are long-term impacts on health, air emissions, cumulative impact when industries collide, and again, need OSHA studies on fast food employees and why. We need to test exposure and make provisions for those closer in proximity and more consistently exposed to this emerging contaminant. So this is a snapshot as I'm going through, and I want to make sure that I can get in these priority populations because, again, Black and Brown communities are not a monolith. We are not all the same. Our demography isn't the same. Our geography isn't the same. Our needs aren't the same, but we are all contaminated by PFAS in this area. So here we go. High priority populations, our concerns, expected mothers. We've heard that consistently throughout the day. It's our concern as well, right? We're all connected and unified in this concern. PFAS, again, can cross over the placenta. The previous presenter already stated this, but I just want to reiterate, being that it can cross over the placenta, our children are then born with pre-existing health conditions by definition, by terms. Our children are then exposed through breastfeeding, if that's the choice of the birthing parent, can then be passed down right through breastfeeding to that infant. So we need blood testing in PFAS contaminated zones that followed by the need for adequate medical care for expectant parent and child, in addition to addressing infertility concerns among men. I want to add this, and as I'm going to the end, because I want to be aware of my time, returning citizens, we need to make sure that testing is available for these populations and confinement centers, and making sure that these clinical guidelines are available for free clinics and urgent cares, not including outreach to food banks and other sorts of areas that would reach this population. Communities living with disabilities. Our folks comprise 18% of the totally extremely low income renters households. What are we doing to make accessible these blood testing opportunities and tracking the healthcare long-term in the data for communities living with disabilities? The last three is firefighters. We are working with Omnibus, a Black firefighter group who has begun initiating a fight against PFAS. Last year was a fight against, unfortunately, discrimination, where they were working at their fire department. This year is becoming educated, informed, and fighting PFAS. Living care facilities and alternative housing for our folks in elderly care. We have over 27 senior living care facilities downstream of the Cape Fear River. They have to be included. We have an HBCU and students that include 161 schools and some that have already been found positive for this contaminant. We need more testing. To conclude here, because I know I'm over my time and I want to make sure that I'm being respectful of that, this is what we're asking. Our communities are willing to undergo testing. They will participate in studies. It just needs to be designed to include our communities alongside our communities. We need to track data over the long run. We need to make sure that insurance claims can actually be viable, which is why we need clinical guidelines in the hands of practitioners at free clinics, urgent cares, ERs, because rural communities oftentimes have to travel up to 23 plus miles just to access healthcare. So these are just some elements, and this slide deck will be shared for folks to look at our breadth of these populations and our needs. So Ned, I'll turn it over to you, and thank you again for having me.